Pat has been feeling sad for 3 months. He lost interest in his passions and quit his soccer team, which was his favorite sport. Pat also withdrew from his friends and family, has difficulty eating and sleeping, and is constantly tired. His doctor suggests that he see a mental health clinician, who diagnoses Pat with depression and sets up a schedule of therapy sessions. Susie has been constantly worried for 6 months. She gets tired easily and has trouble sleeping and concentrating on things, like reading and homework. She sees a therapist who diagnoses her with generalized anxiety disorder and starts her on medication to see if it will help, along with her talk therapy sessions. Pat and Susie are happy. They finally have a diagnosis that explains their symptoms. Now they can get help. Their diagnoses are a relief because everyone Pat and Susie told about their symptoms told them that they were fine, even when they did not feel fine. Although lots of people may have some or all of their symptoms, Pat and Susie were right to seek help because their symptoms lasted so long and interfered with daily living. About half of all Americans are diagnosed with a mental illness or disorder at some point in their lifetime. Anxiety disorders are the most common type of mental disorder, followed by depressive disorders. However, while these feelings and experiences are common, many people do not receive treatment because of the stigma that surrounds mental illness. Stigma is the judgment and ridicule that many individuals struggling with mental illness experience and feel from the people or culture around them. So how can we try to reduce the stigma in our everyday life? One way is to create conversation with people experiencing mental illness. This will allow us to understand their feelings and experiences and lead us to better empathize with them. We can also learn about nonprofit and government organizations and other resources in our communities that help individuals struggling with anxiety and depression. Finally, our website, Youth Engaged for Change, has information, tips, and resources about anxiety and depression. You can also check out the Inspiring Stories page, where people have shared their struggles and experiences with anxiety and depression in hopes to reduce mental illness stigma and to help others who are struggling.